Hi, this is Alfred Brock with the Wayne Focus, and today we have an item for the teens. But hey, if you're an adult, you want to watch this too. If you're a senior, you want to watch this too. Everybody should watch this, learn all about it, so we can all talk about the same thing with the same knowledge, okay? What we're going to talk about today is prescription pain medications. Prescription pain medications. Now, just because a doctor prescribes them doesn't mean that they're safe to abuse. Not safe to abuse. This document was first published in 2011, so it's 7 years old. Now, just because it's older doesn't mean it's wiser, but it is the great stuff. So, you know about abusing drugs like cocaine and heroin. That can lead to addiction and other serious health consequences. But did you know that abusing prescription painkillers, like taking someone else's prescription or even taking your own in ways other than as prescribed, can be just as dangerous? The fact is, it can. But with nearly 1 in 10 high school seniors reporting non-medical use of Vicodin in the past year, some teens haven't gotten the message. Why are these teens risking their health and maybe even their lives? They may think that prescription drugs are safer to abuse than illegal street drugs. After all, the thinking goes, doctors prescribe them, so they must be safe. But that's not the whole story. So we're going to learn about the facts. And down at the bottom, we're going to have a link to what I'm reading to you right now so you can see it yourself. And there's lots of other wonderful things there too for you. This is from Scholastic. So proper use. What are prescription painkillers? Prescription painkillers are strong pain relievers that include the opioid class of drugs, including hydrocodone, which is also known as Vicodin, and oxycodone, which is known as OxyContin. Opioids work by mimicking the body's natural pain-relieving chemicals, but they're more powerful and longer-lasting. They end up masking the pain, in many cases not actually removing it. Now, when the body senses pain following an injury or surgery, specialized nerve cells relay pain messages to the spinal cord and the brain. In response to these messages, natural pain-relieving chemicals called endorphins and enkephalins are released and attach themselves to the body's opioid receptors, where they have several functions. In the spinal cord, they decrease pain-related signals being transmitted to the brain, and in the brain, they act in a number of areas, including those that interpret pain-related information and are involved in emotional responses. This reduces the sensation of pain and any associated feelings of suffering. And although our natural opioid system can relieve certain types of pain, it's not equipped to handle severe and prolonged pain. And that's when opioid medications can be helpful. Now, why do opioids require a prescription? Opioids require a prescription because they're powerful medications. Although they are used safely by millions of Americans who are in pain, if not taken properly, opioids can result in severe health complications or even death. Before writing a prescription for opioids, your doctor must evaluate several factors, including your level of pain or expected pain after surgery, weight, other medical conditions, any other medications you're taking, and your current or past drug use history. The doctor then will decide whether an opioid pain reliever is necessary, if a prescription opioid will safely and effectively treat your pain, and the correct dosage and how long you should take it. But I must note now that even if you have the specified dosage, that over time you could develop a dependency for it, and then it could lead to death by merely ingesting the same amount that you took in the past. So this is very dangerous stuff. Now, your doctor will instruct you how to safely take the medication, or they should, and you should read the booklet that comes with it, including which medications are over-the-counter drugs to avoid and the warning signs to watch for in case you have a bad reaction. By following your doctor's instructions carefully, you'll be less likely to suffer serious side effects as a result of taking the drug or any drug. Now, abuse. Why is abusing prescription opioids dangerous? Abusing prescription opioids can put your health and life at serious risk. Opioids can make you drowsy, nauseous, constipated, and confused. They can also depress your breathing and lead to addiction or overdose. Overdose. Abuse of opioids alone or in combination with alcohol or other drugs can slow or even stop your breathing and result in a loss of consciousness, a coma, or worse. In fact, the number of accidental fatal poisonings involving prescription pain relievers has more than tripled since 1999, and it keeps going up. So it's bad stuff. Things that can happen You can go unconscious and bad things can happen to you. But if you go unconscious too long or you stop breathing too long, you can suffer brain damage before the death occurs, if they bring you back before the death occurs. And these are very serious consequences. So physical dependence. Long-term use of opioids can make the body dependent, and when you stop taking them, you can experience withdrawal symptoms like muscle and bone pain, diarrhea, vomiting, cold flashes. If you're under a doctor's care, he or she can help you avoid or manage these symptoms, maybe. Now, addiction. Opioid receptors are found in the parts of the brain involved in emotional responses, including pleasure. In fact, heroin is an illegal opioid drug that acts on the same receptor system as prescription opioid drugs. Now, heroin is sometimes used in medical care, so this is a very confusing portion of it. Dangerous, dangerous, dangerous. A whole bunch of them. Opioids are dangerous. Now, the dose and the way a drug is taken can affect how a person responds to it. People who abuse opioids often take them in doses or by methods that's by crushing them or snorting them or injecting them other than prescribed. This can lead to high doses reaching the brain rapidly, increasing the risk of overdose and addiction. The pills are set to give off a certain amount over a period of time. When they get crushed or snorted or anything, that all happens at the same time. It's a very bad situation. So here we got some list here of telling us you're abusing opioids if, and then the risks associated with it. So the first one is, you're abusing opioids if they were prescribed to you, but you take more, that's higher doses or more often, than you were directed. If the pain now the risks are, if the pain medication isn't relieving your pain, why not go back to your doctor? Your condition may be getting worse and a different remedy might be needed. By taking more medication, you could be masking important syndromes, and masking is an important word there, especially for opioids. So, second one, you're abusing opioids if you got them from a friend to help relieve your pain. What? What did you do that for? Hey, pain. Now, the risk is pain medications come in different varieties and doses. Some are made for people who have chronic pain and need high doses to relieve their pain. Their bodies have adapted to the repeated opioid exposure, but in this case, yours is not. Taking one of their pills could have serious repercussions for you, even one pill. All right, last one. You're abusing opioids if you take them to get high. Don't do that. Now, the risk is whether or not they were prescribed to you, if you're taking opioids to get high, you're setting yourself up to get addicted. The risks increase when you take them in combination with other drugs like alcohol, marijuana, or other prescription medications. It's not safe, you know. People used to think it was safe. It's not safe. It's not cool. Not good. Or by methods other than those prescribed. So we're going to have a link down in the bottom. You go in here and you can learn all about additional information, and you can go to teens.drugabuse.gov. I encourage you to do it. Share it with your friends. Share it with your mom, dad. Share it with your aunts and uncles, grandmother, grandpa. Anybody's taking care of you. And this goes for older folks too, and the people your age. Share it with everybody. Talk about it. Okay? All right. Be happy. Be healthy. Don't do drugs. Have a great week.